His Excellency Dr. Ashraf Ghani, President of the Islamic Republic of Afghanistan, His Excellency Ibrahim Mohammed Soli, President of the Republic of Maldives, His Excellency Mr. Gotabaya Rajapaksa, President of the Democratic Socialist Republic of Sri Lanka, Her Excellency Sheikh Hasina, Prime Minister of the People's Republic of Bangladesh, Right Honorable KP Sharma Oli, Prime Minister of the Federal Democratic Republic of Nepal, His Excellency Dr. Lote Shering, Prime Minister of the Kingdom of Bhutan, and His Excellency Dr. Zafar Mirza, Minister of State for Health of the Islamic Republic of Pakistan. Also present is His Excellency Isala Virakun, Secretary General of the SAARC. To begin the program, I have the honor to invite the Prime Minister of India, Shri Narendra Modi ji, for his introductory remarks and thereafter for conducting the proceedings.
Excellencies, Namaskar. I would like to thank you all for joining this special interaction. I especially thank our friend Prime Minister Oli, who has joined us almost immediately after his recent surgery. I wish him a speedy recovery. I would also like to congratulate President Ashraf Ghani for his recent re-election. I welcome the new Secretary General of SAARC, who is also with us today. I also acknowledge the presence of the Director of the SAARC Disaster Management Centre from Gandhinagar. Excellencies, as we all know, COVID-19 has recently been classified by the World Health Organization, WHO, as a pandemic. So far, our SAARC region has listed fewer than 150 cases, but we need to remain vigilant. Our SAARC region is home to nearly 1/5 of all humanity. It is densely populated. As developing countries, all of us have significant challenges in terms of access to healthcare facilities. Our people-to-people ties are ancient, and our societies are deeply interconnected. Therefore, we must all prepare together, we must all act together, and we must all succeed together. Excellencies, as we prepare to face this challenge, let me briefly share India's experience of combating the spread of this virus so far. Prepare, but do not panic has been our guiding mantra. We were careful to not underestimate the problem, but also to avoid knee-jerk reactions. We have tried to take proactive steps, including a graded response mechanism. We started screening entry into India from mid-January itself, while also gradually increasing restrictions on travel. The step-by-step approach has helped avoid panic. We have increased our public awareness campaigns on TV, print and social media. We have made special efforts to reach out to vulnerable groups. We have worked to quickly ramp up capacity in our system, including through training our medical staff across the country. We have also increased diagnostic capabilities. Within 2 months, we moved from one major facility for pan-India testing to more than 66 such labs. And we have developed protocols for each stage of managing this pandemic. For screening at entry points, contact tracing of suspected cases, quarantine and management of isolation facilities, and for discharge of cleared cases. We also responded to the call of our people abroad. We evacuated nearly 1,400 Indians from different countries. We also similarly helped some of the citizens of our neighbouring countries. We have now built a protocol for such evacuations, including carrying out testing by our mobile teams deployed abroad. We recognize that other countries would be also concerned about their citizens in India. So, we briefed foreign ambassadors about the steps we were taking. Excellencies, we fully recognize that we are still in an unknown situation. We cannot predict with certainty how the situation will unfold despite our best efforts. You must also be facing similar concerns. This is why it would be most valuable for all of us to share our perspectives. I look forward to hearing your views. Thank you. Thank you very much. I now request His Excellency President Ghani to share his thoughts with us.
Thank you, Mr. Prime Minister. Again, best wishes to Prime Minister Modi. And thank you for taking this very important initiative. All that is normal is disrupted, and all that seems solid is melting into thin air. We are into unknown territory, and our vulnerability, Excellency, comes from our openness. Our greatest vulnerability is that we have an open border with Iran, one of the major centers, and the flow cannot be stopped. And the province of Herat is become the central node for preventing the spread and diffusion of this deadly disease to the rest of South Asia. I have the following 5 proposals. 1, modeling of diffusion impacts and scenarios for management. Unless we model the diffusion, we will be facing assumptions from China or the United States or Iran are not suitable to our situation. I request the task force of SAARC to be able to do this. Second, telemedicine, because the second and third order impact of this, particularly on poor and vulnerable and women, is very significant. If we could create a common framework for telemedicine for diagnosis of related issues, and as advances take place, how to be able to coordinate. Third, As a landlocked country, which is simultaneously the heart of Asia, closing of borders where essential will result in significant problems regarding availability of medicine, food, and basic goods. Can we coordinate to be able to create controlled flows that both allows transactions to take place while focusing on the essentials? The fourth issue for us, Excellencies, because, and all Excellency, because we've cancelled schools, prayers have been stopped. How do we keep women, youth, and children occupied? Since India in particular and South Asia are leaders in distance education and self-learning, can the SAARC satellite and India's satellite be made available so we can keep people, because social distancing that is necessary cannot just take place. And my fifth proposal, Prime Minister, distinguished Prime Minister, since India is both a very important member of SAARC and a member of the Shanghai Cooperation Council, in Shanghai, both with China, that is our deepest sympathies, in Iran. Can we coordinate between SAARC and the Shanghai Cooperation Council through your initiative? How much of the experience of China is replicable to our situations, and how do we both learn and help Iran? I thank you again for this opportunity. Our conditions, being one of the poorest countries and conflict prone, require learning, particularly from how you upscale the existing programs. We have a program across the country called Health, that is basic health. And if there are other countries that have upgraded their basic systems to cope with this, we'll be extremely grateful for learning and yet sharing our experience. Thank you, Excellency.
Thank you. Thank you, Excellency. I now request His Excellency President Soli to make his remarks.
Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Good afternoon. I too wish to begin by thanking Prime Minister Modi for this timely call for a regional initiative to combat the increasing threat of COVID-19 in the SAARC region. In times of crisis, we do come together. In 2003, for example, when the region faced the threat of SARS, the Maldives took the initiative and hosted an extraordinary meeting of SAARC health ministers that adopted a regional common strategy for tackling the virus. No country on its own can succeed in combating the virus. It requires a shared response at an unprecedented scale. The first COVID-19 case was confirmed in the Maldives on 7 March. To date, there are 13 confirmed cases. Fortunately, no deaths so far. Since January this year, the Maldives has been taking steps to get ready for a possible outbreak. We set in place standard operational procedures and facilities for treatment and quarantine in various islands. In the event of major outbreak in the country, our health facilities will have to cope with the care needed for both our residents and the thousands of tourists who visit the Maldives every year. Our priority now is to use precautionary measures to contain the virus as much as possible so as not to overburden our limited resources. The unique geography of the Maldives will always present itself both as an opportunity as well as a challenge. The dispersed islands make it easier for us to isolate communities whenever there is a suspected case. But in the event that a person tests positive in the outer islands and is seriously ill, requiring specialist care, the person has to be transported to the capital, Male. This is extremely costly and puts enormous pressure on an overstretched team of healthcare workers. Our tertiary hospitals in the regions are currently under development. Shortage of healthcare professionals in general and shortage of specialist doctors in particular are always major challenges, and in a crisis such as this, these challenges are several times greater. The Maldives is fortunate to have received general assistance from India, and I convey my government's appreciations to Prime Minister Modi and the people of India. We have received medicine and a visiting medical relief team to work with Maldivian healthcare professionals. Excellencies, in the Maldives, the virus is showing in the most destructive measure the country's vulnerabilities to external shocks. Tourist arrivals started to decline considerably several weeks before the first case was reported. In February this year, arrivals declined by 14.3%. And in the first 10 days of this month, arrivals have already declined by 22.8%. The decline in tourist arrivals has now become so sharp that if the current trend continues, we will have a 35% drop this year. Any significant decline in tourist arrivals has a ripple effect on the Maldives economy. Tourism contributes over a quarter of the country's GDP and is the source of well over 2/3 of foreign currency to the country. Every other job creating and revenue generating activity in the country is either directly or indirectly dependent on the tourism industry. Our industry is also deeply linked to many businesses and supply chains within SAARC region who will feel the knock-on effects from the downturn in the Maldives. China and Italy are the most severely affected countries of the virus, and they are also the number 1 and number 3 source markets for Maldives tourists. Since the beginning of February, in the case of China, and March, in the case of Italy, arrivals from these two countries have been restricted. As a result of this decline, the Maldives is now facing a serious shortfall in foreign currency earning, estimated to be at $450 million. If the foreign currency shortfall continues, it will have a detrimental impact on the Maldives economy, which has an extremely high dependency on imports. The revenue and foreign currency shortfall are also seriously hampering the government's ability to respond to COVID-19 rapidly. The decline means serious shortage in total government revenue. Current estimates show that if tourist arrivals continue to decline, Maldives will be looking at a shortfall in government revenues between $135 to $135.9 million and $446.6 million this year. I am therefore in full agreement with Prime Minister Modi on the need to formulate a comprehensive regional strategy. Such a strategy should, we believe, comprise three key elements. First, we should create space for closer cooperation between the health emergency agencies to ensure that the countries in SAARC have unhindered exchanges of information about the virus and best practices. Second, there is a profound need to formulate an economic relief package targeted to the affected countries. Third, a comprehensive regional strategy to fight COVID-19 should include a long-term recovery plan for the region. I will be happy to speak further on these elements in the discussions. Thank you, Prime Minister Modi.
Thank you, Excellency. Now I request His Excellency President Rajapaksa to share his thoughts.
Good evening, Excellencies. First, I must thank Honorable Prime Minister of India, Shri Narendra Modi, for initiating this video conference to share our experiences, our ideas and best practices, and also to understand the challenges we face and further discuss what measures to be taken to combat this deadly coronavirus. Our biggest challenge is to stop or minimize the virus entering into Sri Lanka and control the spreading of the virus within Sri Lanka. For this purpose, we have banned tourists and other people entering Sri Lanka, especially from EU countries and also South Korea, Iran. We did this following the guidelines and statistics relating to the spread of the virus issued by the World Health Organization. We have also taken steps because we have a large number of Sri Lankans working especially in Italy and South Korea. We cannot stop our Sri Lankans coming back to their home country. We have therefore taken all steps to subject those returning to Sri Lanka to a 14-day quarantine period in selected quarantine centers. As it is important to restrict social gatherings, we have advanced the usual April school holidays to commence from 11th March. Further, we have closed all universities and other educational institutes, also with the aim of minimizing social interaction. Our first case was reported in Sri Lanka was a Chinese lady tourist who since has been cured and already left Sri Lanka. The first Sri Lankan to be infected was a tour guide who had contracted the virus from a few Italian tourists who have already left the country. At present, we have 11 cases being treated in the hospital. There have been no deaths reported so far. We have a specialized infectious diseases hospital, IDH, close to the city, Colombo, with intensive care facilities. This hospital has successfully treated even the first case reported. In all other hospitals designated to treat any suspected cases or coronavirus cases, proper personal protective equipment is used. We have also requested those who show flu symptoms to seek urgent medical attention and also self-quarantine themselves. Close associates of these persons showing any flu symptoms have also been strongly advised to be subject to self-quarantine. The area police and the public health inspectors are closely monitoring the progress of the suspected patients. Public health inspectors undertake daily visits to check on these persons who are self-quarantined. We have also established a national task force comprising all major stakeholders with the power and authority to take crucial decisions have been set up and meet on daily basis with close and constant monitoring of all aspects relating to the spread of this deadly virus. A 24/7 office with hotlines has been established to coordinate all activities related to battling the spread of the virus, quarantine and testing and treatment of suspected and confirmed cases. Government of Sri Lanka has taken some additional steps to effectively meet this unforeseen disaster. The Department of Health started giving out health warnings and advice on precautionary measures needed to be followed for prevention of the spread of the virus. This is done through mass media, presidential media division, press briefings, press bulletins, etc. General public were educated not to go for panic buying of face masks, hand sanitizers, etc. This was quite effective. 12 hospitals were declared as suitable for caring of possible coronavirus affected cases across the country. Managing of stocks of personal protective equipment such as masks, gloves, sanitizers and other medical items required for treatment of patients also started. Since the high risk area for the coronavirus was the city of Wuhan in Hubei province in China, there was a requirement to evacuate 34 Sri Lankan students and their families back to Sri Lanka. This was done by the national carrier Sri Lanka Airlines, which flew from Colombo to Wuhan and back to Colombo with all 34 passengers. These 34 students on arrival were immediately quarantined by the Sri Lanka Air Force before they were taken to a military facility in the Central Hills for quarantine for 14 days under the supervision of the Army medical team. None of them contracted the virus and all were sent home on completion of the 14 days quarantine period. At the same time, another 750 Sri Lankans were studying in various universities in different provinces of China and the government facilities, they were returned back to Sri Lanka. These students were instructed to be in self-quarantine for 14 days under the supervision and monitoring by local health authorities. As you know, probably that our parliament has been dissolved on 2nd March and the general elections will be held on 25th April. So the nominations are being accepted from 12th March up to 19th March. Therefore, we had to take precautions to discourage large meetings, large gatherings. But the elections will be held as planned. When the World Health Organization, WHO, declared COVID-19 as pandemic and indicated that fundamental public health interventions can still limit the spread of the virus and drive down cases even where it was transmitting widely. Advisories were issued for travelers and precautionary measures were taken by limiting travel overseas of Sri Lankans unless it is essential to do so. Almost all major sporting events, international conferences, meetings, large gatherings have been postponed or cancelled. All schools, universities and other educational establishments, including preschools throughout the country, has been closed for particular periods ranging from 2 weeks to 6 weeks. Even gatherings for religious purpose have been stopped by respective religious leaders, initially for 2 weeks. Also, issuance of on-arrival visas has been suspended for all countries. Travel advisories sent to airlines not to uplift passengers from several countries, mostly from EU countries. Travel advisories also sent that any passenger coming from countries which we have defined will be quarantined for 14 days in Sri Lanka. Sanitizing of public transport also commenced from 2 days back. So because of these reasons, our economy has taken a severe blow due to the coronavirus, particularly in tourism. Most of our tourists are from Italy, Germany and other EU countries. And now there is a ban on their coming. Our tourist industry was just recovering after last year's April 21st terrorist attack. Our exports are also adversely affected. Therefore, I strongly recommend the SAARC leaders to formulate a mechanism to assist our economies to tide over this very difficult period. I also wish to recommend that a SAARC ministerial level group be established to discuss, share best practices and coordinate regional matters on combating coronavirus. Thank you, Excellencies.
Thank you, Excellency. I now call upon Her Excellency Prime Minister Sheikh Hasina to share her thoughts.
Thank you very much. Good afternoon to all the SAARC leaders. First of all, I thank Prime Minister Modi for taking this initiative. I also thanks for bringing and hosting 23 of our students from Wuhan along with Indian students during the quarantine period. We need to devise a strong SAARC-wide strategy to fight this public health threat and to protect our citizens. We successfully prevented entry of the virus through strong surveillance and rigorous checkup at all international airports, sea ports and land ports. As of now, we had only 3 COVID-19 imported cases. They have already recovered. There are 2 new imported cases from Europe. We have no local or community transmission of any COVID-19 case. We have set up a national committee to provide guidance to concerned people from all ministries at all levels. We have also undertaken massive awareness raising campaigns everywhere in Bangladesh through all available medias, including social media. My party workers at all levels are active in awareness raising. Local body representatives are vigilant to enforce home quarantine if necessary. We have kept 4 newly built hospitals, including the Kuwait Motri Hospital in Dhaka, dedicated to exclusively deal with COVID-19 patients. In addition, there is one more hospital in Russia to exclusively handle COVID-19 patients. We have also earmarked separate beds in every hospital in all districts to treat COVID-19 patients. A few vacant buildings have been identified where makeshift hospitals can be established in case there is any such need. We also have trained health workers at Upazila levels. School children are also being trained to follow necessary personal hygiene. We have stockpiles of testing kits, infrared thermometers, isolation gowns and masks. Excellencies, I have some proposals that all SAARC countries need to cooperate and collaborate closely to fight this pandemic. We need to force collaboration through our collective capacity, expertise and resources. We are ready to share our capacity and expertise as well as the best practice with the SAARC countries, including providing logistic support if required. To continue this dialogue at technical level, our health ministers, health secretaries and relevant health experts can also have this kind of video conferences to discuss specific areas of cooperation. WHO Southeast Asia Regional Director may be invited to these video conferences. We believe it is extremely important to establish an institution to prevent and fight against any public health threats in South Asian region in future. In our SAARC Charter, it is already there about the healthcare. So we can work together for future, and in future any problem arise, we can work together and we can exchange or share our experience. And Bangladesh will be happy to host such institution if you all kindly agree. Excellency, I really thank you very much, especially Prime Minister Modi, to take the initiative, and also I appreciate that after a long time all the SAARC leaders get together. So it's a very crucial time for all of us. So we have to think about our people's goodwill. So I hope that this will show a new dimension or path to help our peoples of all our country and all the region. Thank you very much.
Thank you, Excellency. I now request His Excellency Prime Minister Oli to make his remarks.
Right Honorable Prime Minister Shri Narendra Modi ji, distinguished heads of state and government of SAARC member states, Namaste and good afternoon. First of all, I would like to thank Prime Minister Shri Narendra Modi ji for taking this important and timely initiative, which I warmly welcome. Our collective wisdom and efforts will help us devise a sound